Hello, welcome. I'm Barbara, and welcome to my crowdcast this evening on Canine Therapeutic Touch and exploring it and all the opportunities we have. So I'm absolutely delighted that so many people have turned up this evening, particularly as the clocks have gone forward and it's Mother's Day here in the UK, and welcome to everybody from all over the world. So there's a chat box on your right and, oh, Julie. Okay, I'll talk about the polls in a moment. There's a chat box on your right, and if you have a look at the bottom where it says say something nice, that's a great place to give me feedback, answer some issues. If I'm asking for something, I can see that immediately. But if you've got any questions to post, please can you put them down below where it says ask a question, because I don't want to miss your questions, because as the chat goes through the session, it disappears off my screen. So if you've got any questions, please put it in ask a question. The other thing about Crowdcast, which is amazing, you can upvote. So if you're not asking the question but want to ask that same question, you can just vote for it, and that puts it in an order for me. The only trouble is when I'm going to go into the questions and answer them, if you could just stop voting, because what happens is, it's happened a few times, they disappear. And I'm home alone here, tech all by myself, which is a really big deal for me. So I don't have anybody reading the questions. So I just want to make sure we get through all your questions. The other thing is I'm just so overwhelmed by the amazing feedback I've had from my other crowdcasts. So thank you so much. I really appreciate it. And we have got this bond because we share this passion for dogs. And we're very concerned about offering the very best canine care and canine service. So it's an interactive session, and I really welcome you to ask questions. I'm going to stop as I go along, check the ask the question box, and if you've got any sort of feedback, that would be great too. So the first thing I'm going to ask you is, can you see me and hear me? Because I can't see your screen. So if you could just tell me if the sound's all right, that would be fantastic. And is the vision, is the graphics all right? Lynn, yes. The sound's okay? Yes, all good. Great. So you can hear me? Fantastic. Brilliant. Thank you, Jane. That's great. Okay. Yep, all good. And a few people couldn't get on, but the thing is, you've got to have good Wi-Fi. So, yeah, and you can hear and see me. Jackie, that's great. Thank you so much. So when you've got a question, put it down below where it says ask a question. And there's also a poll. Now, I launched a second poll today, which I might have to cancel the first poll for that to work. So if you just try and put something in the first poll would be great. The second poll was something special for April's Crowdcast. Brilliant. We've got so many people in the house. That's fantastic. So if you want to know a little bit about my story, you can go on to www.caninehscourses.com in the About Us section. But in a nutshell, I'm a chartered physiotherapist. I have been since 1982, a long time, and I'm a veterinary physiotherapist, and I specialise in dogs. It's the only species I see is dogs now, and I started my veterinary physiotherapy career in 1995, and it's my passion. So as a human physiotherapist, I moved around a lot of specialities, and when I've got to dogs, they do it for me. So that's what's so exciting, sharing clinical treatment techniques, sharing clinical tips, and being a part of your career journey. It just delights me that we can network and share things to help you along your career journey, because the one thing I know is the more you learn, the more you realize you know so little, and there's so much to go out there and find out for dogs. So this is about not necessarily learning something new, but sharing and building our approach for dogs. And I want to tell you a little bit about Therapeutic Touch and what a powerful tool it is and how you can incorporate it into your clinical practice. It's what I've built the whole of Canine HS on. It's what I've centered my teaching, training and sharing techniques for over 20 years. It's also doing a scoping exercise why we're oversubscribed every day of the year that we're open. So I did a scoping exercise of over 400 clients over a few years and asked them, why do they come to Canine HS? Why do they go where we are in a very rural location by other centres? Why do they have an average drive of an hour to an hour and a half? And third, Third came outcomes, the dog getting better. And I was astonished because I was sure that would be the first in the list. So I wanted to know what 1 and 2 were. And the first one was therapeutic handling, therapeutic touch. And if that's what the marketplace wants, it's not only a fabulous clinical tool, it's an absolutely brilliant business tool as well. So listen to your marketplace, scope them and find out your niche and find out what they want, because it's really important when you put so much training and effort into opening a clinic or a centre, especially if you've got hydrotherapy as well, because there's very high outgoings, that you're successful. And we want you to have a really long career to help the dogs in your care. So I'm just going to, can you all see the slide okay? Because I don't see it, it's dark on mine. Can you see that? Has it filled the screen? Thank you, Dave. Yeah, brilliant. So I see a dark screen and I can't really see what's going on. So it's great to know you're seeing that. So I remember clearly in 1980 being told by an amazingly eminent physio who led the UK with her manual and musculoskeletal skills, that therapeutic touch is a two-way process. And I kind of wrote that down in my notes and I heard that. And I thought I understood it, but it was much later on in my career where I was really developing and refining my manual skills that I really started to understand that gem that she gave me. It just kind of went over my head because there was so much more I had to get through on my course. And I didn't really give it enough chance to kind of sink in and clinically understand the relevance of it. But what it was is I suddenly realized that therapeutic touch is a two-way connection. It's a live connection. It's like a two-way stream of information between your fingertips, you know, and the muscles, the skin, the hair, the tissue. And that's how I looked at it at the beginning. And then suddenly I realized it's a two-way connection between me and whoever I was using therapeutic touch was. So at the beginning, it was with humans. And then as I moved into the canine world, it was with dogs. And this absolutely astonished me that I could build a connection by making a therapeutic touch count and making it very clear for the dog to receive it. So I love this idea that's about communication and connection, rather than at the beginning, I kind of just thought about it as the tissue under my fingers. And I realized it was so much more than that. So if you want to ask questions as you go along, please don't hesitate to. As I said, you can upvote the questions as well. We've got a few coming in. I'll have a look at them at the moment. I'm going to try really hard to timestamp them. So when I start the question, if you want to go back and listen to this, because this is available on replay straight away after, and just listen to the specific question, you can as well. So this power that I realized that I had at my fingertips was more than just being able to palpate tissue, was more than just being able to assess muscle tone, was more than applying a treatment technique like massage, therapeutic massage. And it took a little while for me to explore that and build that. And I've been so fortunate and blessed that in my career, I've been so influenced by so many inspiring practitioners. I've shared time with so many colleagues, people who are really gifted that I spent time as part of their training when they came to the Royal Veterinary College, when they came to Nottingham Vet School, and then through Canine Hydro Services, all the courses that we've done linked to serving the university courses and all the other courses we've evolved and developed. And I'm really passionate, as you know, about hydrotherapy, aquatic therapy, physiotherapy, canine rehabilitation, and none of that's possible for me in the way I want to deliver it without therapeutic touch. So for me, it's my core skill. It's what I built the whole business on. It's what I've spent over 25 years sharing with everybody that I've been involved with in their career. It isn't handling skills. It's not general handling skills. It's something so much more. So the first thing I want you to think about is, how do canines communicate? So how do dogs communicate? What are the main communication systems that a dog uses with other dogs and with us? So put it down in the chat box if you've got anything to sort of like share with that. So how do dogs mainly communicate? And then I want you to think about how we mainly communicate, because we have a mismatch across the species. So anybody out there thinking about the last dog that they sensory, Lynn, I love that. So they do this sensory, but how do they communicate with each other? What are their communication systems? So that's great. Thank you, Lynn, for putting it out there. Come on, anybody else? Posture, yes, Alison. They've got posturing. So body posturing, signals, fantastic. Body language. So we've got body posturing, body language, facial expressions. These are their main communicating systems. Yes, eye contact or not, body language, yeah, again, it's coming through. So body language, body posturing, facial expression are the two main communicating systems dogs use. And they back them up. So Dawn growl, but they back them up with noises. They back them up with olfactory, with smells. They back them up with touch. But their main communicating system is definitely body posturing and facial expression. Hair patterns, Bernadette, that's great, because that might tell us there's something musculoskeletally underneath, or it might not, but it's one thing to observe. Now, how do humans mainly communicate? How are we communicating now? So what am I using to communicate with you? Apart from my hands moving around a little bit, that's my backup. Yeah, verbal. So verbal language, fantastic. Voice, so verbal language, that's great. So we have a complete mismatch between the species. Eyes, ears, tail, and mouth. Fantastic, Sarah, thank you. I don't know if you mean mine or theirs, but yeah, all good. So I really want you to think about humans mainly communicate through verbal. Dogs mainly communicate through body posturing and facial expression. And so dogs are watchers. They watch, they observe, whereas people are listeners. So we do have this mismatch going on. So humans are listeners, we use verbal language and we back it up with some hand signaling, and we have non-verbal language too. Dogs are watchers, they communicate mainly by their body posturing and by their facial expression, and they use expression through their ear posturing, eyes, nose, tail, body posturing totally. And then sometimes, depending on their coat or their breed, you can't read all those signals. They give out social signaling, and it's also called feedback signaling, but I call it calming signals. And this is an area that T-Touch practitioners absolutely excel in, because they've developed and been inspired. The whole movement was inspired by Moshe Feldenkrais. And Moshe Feldenkrais also inspired the whole of the NLP movement. And he was all about body awareness and body posturing. And at that time when he came out and he was very eminent, there was also Alexander teaching, and Alexander techniques. A lot of musicians use those, a lot of dancers use those. And as a physiotherapist, I became a Feldenkrais practitioner, and I amalgamated a lot of Alexander techniques along with the other techniques that I've built up over the years, and been influenced massively by some really leading people in their fields. So just moving on to the next slide, let me just, so again, no tech support. So hopefully you can see another slide. If you can just let me know if you can see that. Hello, Claire. Great to see you. Yeah, brilliant. Thank you for letting me know. Right, so therapeutic touch and therapeutic handling. What is it? What it isn't general animal handling. Therapeutic touch is where you're making every specific touch count. It's meaningful. And we want the computer of the dog to hear that language really, really carefully. Dave, you want me to list these for us to read more on after? Okay, I'm not sure what you want me to list, but maybe you can email me and let me know a bit more detail. I can definitely do that later for you as well. Okay, so I just don't want you to confuse therapeutic handling with general handling. It's not to be confused with your social handling that you have with your own dog as well. So therapeutic handling is what you're going to use in your clinic environment with dogs that you see professionally that are coming and visiting you very often with pain issues, very often with issues of coming into a new environment. And so you're going to use your therapeutic touch and your therapeutic handling to set the scene, to make that communication with you and the dog as positive as you can. And it's about working with the dog, not working on the dog. So you are going to build this professional bond of trust between you, and you're going to use touch as one of your key areas, as well as you developing your own body posturing, because you can tell the dog so much if you use the main communication that they use as well. So in the slide, what you can see there, it's an aquatic picture. I've got a proprioceptive paw placement on the right pelvic limb, on the right hind limb. And that's a technique that we have in our level 5 advanced canine hydrotherapy treatment techniques. And we explain all about that. But the hand hold at the front isn't just holding the dog. It's a therapeutic hold. And that therapeutic hold specifically, we call it a spider hold, is on what we call a key point of control. Now, key points of control are fantastic for you to know about. So let me know, has anybody here heard of key points of control? Do you use key points of control? Humans have them and dogs definitely have them. Anybody listening? Not yet, Sarah? Thank you. No, so a key point of control is much more than just a break. Okay, that's giving me some idea. Yes, Julie. So key points of control are a place where you can control a sequence of movements. So as you know, the dog doesn't organize movement at a joint or at a muscle. It's a global sequence that's organized by the proprioceptive system. Do I need to refresh my screen? Sorry, Sarah. Can you see the picture? Have you lost the picture? Okay, all okay there? All right, thank you. If you're losing the screen, it might be with the Wi-Fi. It's come back. All right, did it disappear? Okay, thank you. All right, thank you, Kelly. Just keep telling me what you're seeing. All right, so let me just move that then. I've just got to hover over there. Okay, so I'm thinking about techniques that you're going to use in the professional setting as professionals, working with dogs that you don't know, that very often have pain issues, very often have movement issues, and you're trying to use these techniques to improve their movement. So your touch is so much more than just palpation. It's a communication. And I want to just, like, if I go on to the next slide. Hopefully, can you all see that? Is it clear? Because it's dark on my screen. Right, Lucy, have you got the picture back? Hopefully you can see that, but it's a slide that's showing you about movement enrichment techniques. Now, has anybody here used feeding enrichment with their dogs or heard of environmental enrichment that we use in, yeah, all okay. Thank you, Lucy, for letting me know. So anybody here use feeding enrichment for their dogs? Have you heard of it? Are you aware of environmental, Richard? Richard's saying yes, Julie's saying yes, fantastic. So if we've got feeding enrichment and it's such a valuable way to help the dogs express themselves because they have to scavenge, hunt, explore, use their brain, and it's what they would do in the wild, clearly movement enrichment is something that we can explore and develop. And movement enrichment techniques are about enriching your clinical environment, so using clinic enrichment techniques, as well as using therapeutic handling. And the two together just go together amazingly, like fingers on your hand. And what they're going to do is they're going to offer movement enrichment in your clinical setting. And when you offer that, you can improve dogs' movement significantly. And then if you can layer in some other specific treatment techniques as well, using therapeutic handling actually binds your treatment techniques together to have very successful outcomes, as well as being a standalone treatment technique. I had an amazing group of physiotherapists working with me this week, and some hydrotherapists came to visit me as well, which is really exciting. And I introduced them to clinic enrichment. And I love it that they go, that's so obvious, that's so clear. I love it that we can kind of get that information over in a very logical way. There's a lot of science backing it and supporting it, but it is, and I like it when they say, oh, it makes common sense, that makes sense to me, because that means it's kind of, they can relate that into their everyday clinical environment as well. It isn't about putting down a proprioceptive track, and it isn't about lots of colored equipment. So clinic enrichment is so much more than where your walls, doors, and how you set the room. It's also how you use that embodied posture within it. And so your clinic enrichment treatment techniques are a fantastic tool for you to have in your therapeutic toolbox. So what we're doing with movement enrichment techniques is that we're trying to optimize or improve the movement in that clinical setting. The therapeutic handling, what you're using there is you're using a whole range of techniques that include T-touch, therapeutic touch, movement shaping, therapeutic holds, therapeutic lifts. The list goes on endless. I've got another slide with some of those listed for you to think about. One of the most common questions I've been asked over 22 years by amazing therapists is they've got lots of knowledge, they've got lots of tools, but they've struggled a little bit with maybe more reactive dogs or how to start the session. So without therapeutic handling, I would be lost. Therapeutic handling and clinic enrichment offers me the opportunity to be able to communicate directly with the dog as it enters my clinic, as it moves around the clinic, as I apply techniques, and it is a technique in itself. So it's a real win-win situation for you. And it's a fantastic way to practice because you're getting the dogs to work actively and engaged with you. No, sorry, Laurie, is that, sorry, can you see the picture? Have we lost the picture again? Everybody okay on the picture? So with therapeutic handling, what we've got is we've got a manual transmission of information through touch. So how you apply the touch, the speed you apply it, where you apply it, and why you're applying it really matters because there's more of it than just touching the dog. It really links in clearly to biomechanical design and the canine behavior of that dog. And how many out there of you own dogs? Let me know. Everybody here own dogs or work with dogs? Have we got any people here who've got more than one dog in their pack at home? Yay, we've got lots of lovely dog owners out there. And your social engagement with your own dog is so different to your professional engagement with a dog that you don't know. Izzy, 4 dogs, fantastic. We're loving the big packs. The more the merrier, 5 in my crew, fantastic. Do you think your dog has a personality? I really want to know. So I was told they have a temperament, they don't have personalities. I believe 5 collies, they've all got their own personality, just like people. Who feels dogs have got a personality? Of course they have, Lynn. They've all got their own individual personalities like people, but a lot of people out there consider a breed has a temperament and they're all the same. We absolutely know that they have different personalities within the same breed, across the species. I'm loving this feedback. I'm loving it. Absolutely. Yeah, definitely. You can have them in the same litter mates, and they're totally different. So we know dogs have personalities. And like people, personalities can affect their physicality. So when we're looking at healthcare, we're looking at so much more than just palpating and feeling muscle tone, feeling muscle atrophy. All right. And if we don't use therapeutic handling, we might misread the information because what do you do if you're cold? What do you do with your muscle tone if you're cold? Do you shiver? Do you shrug? Do you bring your shoulders together like this? You are increasing your muscle tone. Okay. What do you do when you're angry with your muscle tone? If you're very angry or very upset, do you think your muscle tone changes from when you're super relaxed, spending time with someone you really care about? Yeah, so we tense up, don't we? So muscle tone is going to be different. So if we're only using therapeutic touch to listen to muscle tone, find muscle spasm, palpate for painful structures, you know, and we haven't actually connected with the dog, the muscle tone we're interpreting might not be because of a physical issue. It may be because of the uncertainty of being in a clinical environment. It may be because of the tension they're receiving from their mum. It may be they didn't travel well to your clinic and feeling really awful. So there could be other reasons that when you palpate structures, they're not the norm. And that's where we come to a really important thing. We don't have a lot of base levels. So if we don't have the norms, it's really hard to find out what will be abnormal. So therapeutic handling is going to help you with that initial touch with the dog, that first touch. It's a balanced moment. When you use clinic enrichment, it isn't about going to touch the dog and it isn't about going to ignore the dog. So interestingly, I've been told by quite a lot of people, they've been advised to ignore the dog. Never ignore the dog. The dog's center stage in my clinic, but I'm going to, like a triage, work with the owners and with the dog. But touching too soon or not touching soon enough, that's a balance. So that's what I love about working in canine therapy, is that it's a solid scientific foundation of knowledge and understanding, but there's an art form for it. And as I've developed my art form, it's like your personal signature. And that's what I'm really hoping, that we've got 7 questions sitting there. So I'm going to take a break in a moment and go and look at the questions. So any questions you've got about what I've just been talking about, but it's about introducing this therapeutic touch and using it to help us connect with the dogs as well as interpret information. So I'm just going to leave that with you. So those of you who haven't seen dogs in natural balance motion, or haven't listened to any of the other crowdcasts, they're there on the resource page on caninehscourses.com. They're free. You can access them directly. And when you have, you can get yourself a certificate for the length of time the crowdcast went on, plus that little bit of extra time where you're asked to do a little bit of reflective practice. And I'll explain that towards the end again. But this is just a slide for you to think about. We know the fact is, the scientific fact is, the CPGs, they are central pattern generators, also known as central processing generators. These are the mini computers that we have a few in our spine, not many. We mainly organize our computer that mainly organizes our movement is in a different place and uses different motorways to the muscles than dogs do. But in dogs, they have loads of CPGs in their thoracic and lumbar spine, and they have automated movement. And these CPGs give out a rhythmic output, and they drive. They are the drivers of canine gait and canine swimming. Okay. And why is this important? Because canine movement, which is driven by the CPGs, which is part of the central neural system, is all about proprioception and muscle power. So muscle power is like the engine of your car and gives that dog the power to move, but it's initiated and controlled and orchestrated exactly by the proprioceptive system. And the proprioceptive system is something we can influence as therapists. So by using therapeutic handling and clinic enrichment, these are proprioceptive enriched treatment techniques. So by using those alone, you can improve and influence the information that the central nervous system is having to then increase the quantity, the quality of the information to the muscles and to improve and affect movement in the dog. So it's really, really exciting. You can use these techniques standalone, or you can use them as the glue to put together your other techniques from your therapeutic toolbox. So 6 questions, let's just have a look. Difference between touch and therapeutic touch. Okay, Richard, I'm not quite sure what you mean, but the touch, when we touch, if you just touch yourself, what I'm saying is touch, you're going to have an information flow depending on how sophisticated your tools, your fingertips are, or your hand, or your interpretation of the information. Therapeutic touch is where you're making each touch extremely proprioceptively enriched and you're responding to the species you're working with. So with dogs, you're responding to their feedback signals and you're thinking about where you actually apply each considered touch, because you've got power points on the body. You've got key points of control, and you can apply a therapeutic touch to a key point of control and control a whole sequence of events. Whereas normal touch, where you're just touching, is only going to pick up information very locally underneath those fingers. Thank you, Jane. Therapeutic touch for a specific reason, and I'm going to give you a list of all the different reasons you could use therapeutic touch. So these are specific control points that you can use and specific ways you can touch to have a huge influence on movement patterning and movement. Whereas a normal touch is just picking up the touch underneath the tissue that you're feeling. And it can be contact touch directly on you, or it can be indirect touch where it's on you but through something, or it can be an indirect away from you through something, which we're going to talk about. I hope, Richard, that answers your question. Let me know if you've got another question there. So the next one is from Bernadette. Thank you very much, Bernadette. So I'm going to start answering that. Except you're upvoting and it's disappeared, Bernadette. So I will find that in a moment. Okay, so I've gone and clicked accidentally on Dave Taylor's question and I've said done answering. So Dave Taylor's asked me, how can we use therapeutic handling to help a nervous dog enter the pool for their first time? We can use it massively with our body posturing, as well as understanding how to use motivators. These aren't training techniques. These are working the dog in balance and building that professional bond of trust and confidence so the dog will actively engage. And if they can't actively engage because it's so overwhelming, thinking of solutions and strategies to help the dog be able to cope with that very difficult thing of entering another environment or exiting it if you want the dog to move in balance. So that's definitely something, and we've talked about that a little bit before in one of our previous crowdcasts, but I can come back to that. So I'm going to answer the next question, which is from Bernadette. So I'm going to start answering it. Please don't upvote for the moment. And her question is, how do you adapt therapeutic touch techniques for pool or treadmill? And she's thinking of therapist well-being. So therapeutic touch, where the therapist is applying it to the dog in a pool or in an underwater treadmill, I presume you're saying there, Bernadette, rather than a dry land treadmill. You are going to be able to use a variety of touches. So it's not just one touch and it's not just one hold. We have vertical, we have horizontal, we have asymmetrical and symmetrical holds, and I can share a few with you as well. And this, Bernadette, might come up in my offer for April to you all, which I think you might find really interesting, because I was really fascinated by a few perspectives I've come across the last week. And the perspective that online courses aren't as good as face-to-face courses, I find very unusual with the amazing tech we've got. So I feel when you look at all your major universities, they're running online courses. This is an online forum between us, and I'm having interactive discussion with you and professional discussion. At universities, there's Blackboard, there's loads of forums that people can directly access their tutors. We use appear.in, which is a video chat, so you can access that. So if the course is face-to-face, if it's online, they've all got value. But to denote that one's above the other, I don't really understand that, because we've designed canine instructional videos. So all those YouTubers out there, anybody here use YouTube to find out how to do something? Has anybody here in the audience used YouTube to find out how to bake a cake, how to build a house, how to fix your printer that doesn't want to print? Yes. And if you're like me, I watch the video and I stop it a million times while I'm doing it. Yeah. So it's a really valuable tool. So how about you have an instructional canine technical video showing you moment by moment treatment technique? Surely that's got some value, because when I've seen demonstrations, sometimes I'm not that near. I might see one demonstration. You may get some experience with support to practice it, but not many. So the fact, I love learning by doing. And I really want that experience when I'm trying to do a task, to have a repeated experience. So my new tutor, who's an amazing person called Marie, who is my mentor, has helped me through Looms, and they are videos. And what she does is she shows me the IT tech that I'm struggling with, and I literally go through it, and I find that it is amazing. So I've launched a whole load of Canine HS, Canine technical videos. They sit in my level 5 course. They're about 20 minutes long. Some are 10 minutes long. I've got 2 or 3 minute ones in my level 3 course. And my offer for April is, would you be interested in me putting together a canine technical video on therapeutic holds, and maybe a therapeutic movement shaping, so you could see it in action moment by moment? And I think it would be really valuable for you to be able to see that, replay it 100 times, 1,000 times, and try it out yourself. And so for me, I feel this has got a really strong opportunity for people who love doing things like canine hydrotherapy, like canine physio, to develop and refine skills, because not everybody can travel to conferences and not everybody can go on courses. We're so busy. So let me know. And there's a poll, there's a second poll. I don't know if you can vote on it, but I'm looking at what you prefer. And I could put a mini canine TV together for you as a free resource if you're interested. So going back to the questions, I'll just see there's a few more questions there. I think, Kelly, I think I answered this. This is, do you have to be a canine physiotherapist to attend the event? No, this is open to canine therapists. This is open to canine trainers. This is open to canine owners. But it's really valuable for canine physiotherapists and canine hydrotherapists and canine rehabilitation therapists and animal therapists, because it's our day-to-day practice, working in a clinic environment and meeting and working with dogs that are not our own, usually with movement and functional demands and maybe some behavioural issues because of pain. So they're ideal techniques for you to refine and use in your day-to-day practice. Oops, Kelly, your computer has stopped. I hope it's all right. Thank you, Bernadette. It's all about the quality of content. Thank you, Bernadette. It is about accessibility. It's also about being able to have it the immediate ability to immediately look at that and over again. I know the feedback. We can monitor how many times people are watching our canine TVs in our level 5 advanced canine hydrotherapy treatment technique course. It's hundreds and hundreds of times. So I know that they've got an appeal where people can watch those techniques. Moment by moment practice. You know, that's how I learn, visual and then by doing it myself. So, okay, so can you tell how to spell the name of the technique you mentioned? Kerry, thank you. What technique would that be? I have been chatting away, so please put down the technique, how to spell the name of that technique you mentioned. Therapeutic handling, clinic enrichment, key point of control. I'm going through them. Let me know, Kerry. Pop it in the chat box and I'll watch out for it, and then it will help me to know. Okay, so I'll come back to the questions. As some more questions, vote them up. Just going back to the slides. So we're thinking of canine movement. Canine movement is proprioception and muscle power. So you need to know everything there is to know about these two areas. So what is therapeutic touch? What is therapeutic handling? It's a two-way communication through touch. It's a live connection between the therapist and the dog. It's working with dogs and providing them with choices. If they have a choice, they will work with you actively in a confident and trusted way. It's not about working on the dog. It's about calming. T-Touch practitioners are astonishingly gifted. They work with T-Touch and it's about calming, modifying behaviors positively. It's about trust building. Therapeutic handling takes that and it puts it into the movement and functional ability, the day-to-day functional abilities of the dog's forum. It's about building trust, and when you build a trust with the dog and the owner sees that, the owner wants that, and it wants that over anything else they've seen. So it's got a two-prong kind of effect in your clinic. It's really helping the owner make a choice that they want to come back to you and choose you over everybody else. It's also helping the dog build that trust. So when you ask it to do something unusual or have a piece of equipment nearby or do a particular, approach, it can manage to do that in your clinic successfully, so you will get a great outcome. So it's developing that professional bond of focus and confidence. Feldenkrais, thank you, Julie. Feldenkrais, Moshe Feldenkrais was an amazing individual. He was a small man, an Israeli. I was very, very lucky to being introduced to Feldenkrais techniques when I was a very young physiotherapist, a human physiotherapist, and we used that extensively. And then I came across someone called Renata at Runwell Hospital in Essex, and she took me to somewhere else with Feldenkrais, and I fell in love with that approach. And then I believe T-Touch was inspired by that, sort of a little time after that. And then the NLP movement, which is worldwide, and it's about body awareness and neural networking, was also inspired by Moshe's work on body awareness, and he in turn was really inspired by Traeger. So there's an evolution of these techniques that go through time, and then taking it on and developing therapeutic handling. That's something I took into the Royal Veterinary College, their master's program in physiotherapy in 2004, and it keeps evolving and developing. So it's about developing a professional bond of focus and confidence with the dog using clinic enrichment and therapeutic handling in your clinical setting. It's encouraging active participation. So all the therapists out there will know a dog that actively participates, that actively decides to consciously mediate and make a decision to actively move with you is hugely proprioceptively enriching. It's about them being in a focused state where they're listening to the information the therapist is guiding them with. It's not about fooling around. It's not about flight or fright. It's about that focused, alert moment where you have their attention and they're engaging with you in an active way. This connection is very emotional for therapists. It doesn't stop affecting me every day. I tingle when I feel that connection in the pool, in the underwater treadmill, on land. It's just a wonderful bond of professional trust between me and the dog, and it's the best job in the world. It's also responding to canine feedback. You can't just go in a one-way street. It's a two-way connection. And how you know how to do the next touch, where to do the next hold, how to do the next lift, is because you're actively observing the dog and watching their facial expression, their body posturing, and answering in their language, and you're being responsive. So it's in real time as well. So it's really exciting. Thank you, Ash Ponting. Great to see you. Just watching it come. Yes, it is really emotional when you get the connection. I've had people where I've showed them myofascial release, whether it's in water or on land, and they're tearing up, and I'm tearing up because they're tearing up because I'm feeling that release through them, because as I walk them and talk them through it, and watching the dog's emotions. And the owners are really emotional as well, because they love seeing their dogs connected. And then what's more important for me as a physiotherapist, not only am I emotionally bonding with that dog in a professional, trusted way, I'm watching their movement improve in the session, not after 5 sessions. My neural background is I'm a neurophysio and I'm a neuroveterinary physio. Within 1 session, I'm seeing changes, very clear changes in our dogs that have got tremendously complicated neural problems or challenges or conditions. So that's really, really exciting for me. Thank you, Lynn, for that. So next slide. I hope you haven't lost the picture. So when can you use it? When can you use therapeutic touch? It positively influences behavior. It's a successful interaction. Julie, you should be doing this crowdcast, not me. I'm getting so emotional just thinking about all the dogs I've had the pleasure and privilege to work with this week and the connections I've made. It's just been wonderful. And I love sharing that with other people. I love sharing and teaching other people and training other people these techniques, because it's just I smile every day I go to work inside, and I smile with tiredness at the end of the day, and I can clinically reflect on all those successful interactions. It's wonderful. So one of the questions I've been asked for a very long time is, how do you start? How do you start that first touch with the dog? Well, therapeutic touch is the most invaluable tool to make your initial touch successful. Now, you may do it indirectly through lead stroking. And lead stroking, again, is another amazing T-touch technique for calming. And again, putting it into therapeutic handling, what it's done is transform it into also initiating movement. And so we use that a facilitatory T-touch lead stroking technique, and we use that symmetrically, asymmetrically, double leaded, single leaded. It's a connection, it's an email directly to the dog's proprioceptive system. If you use facilitatory sweeping, which is upward, it's always upward on muscle tissue, and it's always upward on a key point of control. And we happen to put collars on dogs, and we happen to connect leads to dogs, and the neck is a key point of control, and it's one that you can easily take a dog out of balance. So as a therapist, a therapeutic hold, we're going to use a core therapeutic hold. So I've got some pictures going on, and I'm going to show you and go back with them, but I want you to think about the sternal therapeutic hold. It's a key point of control. It's the manubrium, the top part of the sternum on the dog. It's where you've got the harness at the front when you have the ring here on the picture. I don't know if you can see the arrow. There we go. I think I'm there. Okay. It's the sternum, the front of the chest. And it is a key point of control, and it's more than that. It's your sternal handbrake. It's like driving a car. It's a handbrake. But it's more than that. It's a control mechanism of a sequence of events, but you need to have the dog in balance. We've also got therapeutic lifts. That's not lifting on the skin, that's something different. These are lifts where you're actually physically lifting the dog up, and you may be doing that on land, you may be doing that in the underwater treadmill, you may be doing that in the hydro pool. And these are incredibly useful techniques. And in the pool, I can very comfortably, and I'm 5'3", quite small, I can very comfortably pick up a dog up to small Labrador Retriever with a therapeutic hold, not on land. On land, it's going to be just for small dogs, as I've got a back injury, which I carry and manage really well. So these therapeutic lifts are not about a cuddle lift. They're not about a hold or a restraint. They're not or a hold that is to contain an animal to do a process too. Therapeutic holds are interactive with the dog in active balance. Therapeutic lifts are interactive with the dog in active balance where the core is in a neutral position. And it's a very valuable tool to help the dog positively engage in an unusual environment like water. We can use a therapeutic touch with assessment techniques, because if we link and bond with the dog, their muscle tone is going to tell us the true picture of where it's at, not they're anxious, not that they're worried, not that they're cold, not that they're tired. So we're getting a very reliable information. So assessment technique, again, rather than going locally, we'd use our assessment techniques therapeutically to globally get an understanding, a geography, an overall sweep of the body, not going to the area perhaps where the main problem is, but we'll get to there eventually. And we're looking at the feedback signals in response to that assessment sweeping. And then we're going to link with therapeutic handling and build that bond of trust to then maybe go and engage. So what I do is I mash up my assessment touches with my therapeutic handling. So it's like I'm assessing the dog and it doesn't know I'm doing it. And then I'm going to select where I go and for how long and the speed I go. And all of that is the art of the therapeutic handling, built on the scientific base that it's hooking into the proprioceptive system. Julie, this is your thing, come on. A balanced lead like the one on the slide on an anxious dog who's stopped racing around. So yes, this is 2-point control. So what we've got here is a wonderful dog who's no longer with us, but was one of my soul dogs and heart dogs who belongs to somebody at work. Very important to me, wonderful Brizzy. And that's a 2-point control where we've got a connection to the sternal hold, which we can use as a hold, but here we're making it dynamic and we're making it influence a sequence of balanced movement if it's attached centrally. And then the attachment of the other part of the lead, which is 2-point lead, is just beyond the dorsal borders of the scapulae, just at that point, and that's acting like you're braking your car. So in this instant where we make it dynamic, we're using a balance lead, a 2-point control balance lead, dynamically as a hold. Whereas when we apply a hold with our hand at the front, we're now making it a static hold. So these are very versatile techniques that interlink. Thank you for sharing that, Julie. Yes, and it's great. I had a dog that was pulling for 9 years and always pulled like a Trojan. And I did some balance work. I used therapeutic handling, clinic enrichment, therapeutic holds, 2-point control, and it never pulled again. And that is unusual. I'm not saying that happens every time, but you get your successes. Just don't have expectation. Just enjoy the moments you get these successes. So myofascial release. Anybody here use myofascial release? Anybody here use it on dogs? Use myofascial release on dogs is absolutely wrong. Use myofascial release to engage with tissue on dogs. Yay, fantastic. Bernadette's telling us about 2-point control, understanding how to move dogs in balance. Myofascial releases are an amazing tool. They're very powerful tools, so be very careful what you decide to release. And you always release towards the point of restriction. Fantastic. We've got people in the house who do myofascial release on dogs, which is fantastic. Very different to human myofascial releases, totally different to equine myofascial releases. Please, when you've got a different species, use species-specific techniques. So it's always beneficial, so it's always positive, and has the most amazing outcomes. We also use it for therapeutic handling and therapeutic touch. We're going to use that for clinical massage. Anybody yeah, I would love to do a myofascial release course, but if enough people ask me to do it, I will put something together with the most amazing canine technical videos, canine TVs, which will be instructional TVs, so you could see it moment by moment and refine your skills remotely as well. So anybody here do clinical massage? We've got some interesting response there. Great, thank you, Dave. You'd be interested in myofascial releases? Bernadette would love more. I love teaching it. It's fantastic. Lots of mirror work, lots of you exploring tissue and connection, lots of therapeutic touch and the power of therapeutic touch and the shock of it, that you feel it on you and can't believe, what was that? So they're very, very big, powerful tools to use very carefully. Anybody here do clinical massage on dogs? Anybody work with massage? Is anyone doing aquatic massage? Yes, Jane, very memorable. I loved working with you. Okay, so clinical massage is a great technique when used with therapeutic handling. Yes, Bernadette, pushing my buttons, 3 already. It's worth writing a course for sure. Yes to massage. Yeah, great. So are you doing that on land, clinical massage? Are you doing that in water, in a water environment? So your hydro pool, your underwater treadmill is a hugely proprioceptively enriched environment if you know how to utilize therapeutic handling within that environment. Mainly in water, fantastic. So some land-based clinical massage, aquatic clinical massage, it is completely enhanced when you use therapeutic handling. Seems to get better results massage in water. Now that's really interesting. Is that because your skill's greater in there? Is that because you're doing it more in there? Is that because what are the tools that you're using? So I'm fascinated by that. So yeah, so that's really interesting. So then we've also got soft tissue mobilizations, which are different to clinical massage. Soft tissue mobilizations, a lot of physiotherapists are using those, joint mobilization techniques and manipulation techniques. So obviously you work within your scope of practice wherever you're training, which is your initial block, your foundation that you leap from, and then your amazing canine career journey. So where's your CPD? What kind of training are you doing to advance certain areas? So that's what Canine HS Courses is all about. Giving you choices, giving you opportunities to let me know what areas are you interested in developing, and then we can put something together for you to meet your needs. So movement therapy is a huge area that I love working in, and proprioceptive rehabilitation, fantastic results from that with all kinds of post-op rehab, all kinds of performance enhancement as well, and static and dynamic therapies, and the list goes on. So therapeutic touch, absolutely key, is a core skill. Yep, underwater massage is excellent. Loving that hydromassage shower work. We're using that a lot with great effect. So we've got a few more questions to go. If you've got any more questions, please put them in the Ask the Questions. If you can let me know, can you see the new picture coming up? Key points of control. Key points of control have been inspirational to me as a physiotherapist, as a human physiotherapist. I came across them with Berta Bobath in my neuro work, and these are neurodevelopmental key points of control. They're much more than sternal handbrake on the dog. So here in this picture, you can see, oh, Andrea, I'll come back to your question. What is my myofascial release? Please, could you just put it in the Ask the Question? Because as people come down, I'll lose that question. So MFR is myofascial release, and it is a manual technique that you do where you engage with the tissue. Key points of control is a technique that you can use with your therapeutic touch for a multitude of different things. It's not just a sternal handbrake, but the sternal handbrake is one of the core skills you need when working with dogs. And here you can see it's a vertical weather handbrake. So I'm just going to go back through and show you some of the other pictures. So right at the beginning, in this picture, can everybody see the picture with the lovely little Chihuahua? Does that come up on the screen all right? Any feedback would be great. Can you see the Chihuahua? He's called Mr. Darcy, and he has a partner called Emma. So those who love Jane Austen, you're going to smile about that one. Okay, but on this picture, the proprioceptive paw placement, which is a PPP technique, is balanced out with a spider hold. And the spider hold is sitting on the harness, not on the dog. and it's using your fingertips. It's a very valuable, yeah, hi, Mr. Darcy, he is so cute, and he is so in command of everything in his life. Okay, here, can you see in the picture with the wonderful Basset Hound, who I absolutely love. Here it's a spider hold that's horizontal, and I'm using the harness to administer that hold with, rather than, and I've just got a few fingertips on the dog, because some dogs don't like overhandling. On the right here, we've got the picture here, and this is showing you 2-point control, where you've got active engagement of a focused dog working with you because you're administering therapeutic touch through a lead. We're not walking a dog with a lead. We're actually administering a balanced, coordinated control of information going through 2 points onto the dog. So that's like an indirect therapeutic touch. Here we've got a lovely horizontal weather hand hold. So it's a weather hand hold that spans the harness and the dog. It's a wide hold. There's a 2-point control hold, and that's a vertical hold on the boxer. So there's a range of holds for different postures, and there's a range of holds for different canine behaviors. Different dogs with different personalities are going to need different holds. Your high drive, Ferrari, Border Collies, level 7 agility are going to have a sternal handbrake to contain them. Okay, and where you've got an elderly dog, 14 years old, golden retriever, 9 steps in their repertoire before they collapse like a heap, you're going to use a different kind of hold, obviously, for them. So here are a few pictures of some holds. Can you let me know if you can see them, please? So this lovely lady here, Meg, is 15 years old. Love this dog to bits. She's still running around in charge of her pack. Here, this hold here, okay, is a puppy hold. The puppy hold is really different. The picture has shown you up to now of a lot of sternal hand holds. You've got to be thinking, where's the therapist and what is the therapist doing with their body posturing while they're administering the hold? So think of it as driving a car. The hold, you're holding onto the steering wheel, but your body posturing, your body movements are the pedals and the gears and are the power. Okay, but the hold is really important, that you're holding the steering wheel, because otherwise you can't drive the car. So think of it that way. And I want you to think of it as, you know, a very delicate touch steering and the pedals very delicately engaged. So they're not sudden movements, and they're definitely not surging movements. It's about moving with the dog and through the manual transmission of your holds, influencing the dog's movement to your command, to your guidance. The puppy hold's really different. It's also called a suitcase hold, where the hands are flat and then just tuck round like a hook hold. And again, that's on another key point of control. And you can have symmetrical puppy holds and you can have asymmetrical puppy holds. And the idea is the therapist refines their skills so they can move from one hold seamlessly to another hold while they do some body posturing. So you're having a communication directly with the dog about where you would like them to go, where you would like them to statically balance, where you would like them to dynamically engage to. Any more questions? We've got some questions there building up. Okay, I've got a couple more slides. So this is the crunch. You need to link your therapeutic touch to canine biomechanics. It's not just about the canine behavior, it's also how the dog is designed to move. The dog is designed to move in a very specific way, and we cover that quite a lot in Dogs in Natural Balance Motion, which is another crowdcast, so you can go through that. You've got to link your therapeutic hold to your functional anatomy. It's a reason that the therapeutic hold is the manubrium. It's the top part of the sternum. It's a key point of control that we can use to dynamically engage movement, but also to apply a sternal handbrake, which is invaluable because you can now control and guide the car rather than the car or the dog going where it wants, and you sort of holding it, but not fully connected. Love this picture. So this is just to remind you, it doesn't have to be direct contact on the dog, because some dogs just can't cope with having direct touch. It's just overwhelming for them. So you can use these holds through a towel. you can hold the harness instead of the dog. But also, if the harness comes off, you can then engage on the dog, and it has the same powerful connection with the dog, as long as you do it in balance with the dog's feedback signals. So it's a two-way engagement. Okay, let's go back to some questions. I'm going to leave you with that slide for the moment. I'm going to bring the questions up. We've got a few more coming through. Right, I've got a yes from Lucy. Lucy, I'll start answering, but I've just got a yes on there. So Lucy, I'm not sure what you said yes to, but it's really great that you're listening and joining us live. I really appreciate it. Thank you so much. I've got another one from Andrea. What is MFR? Myofascial release. So it's a manual technique that we use to engage and release tension out of tissue in a very controlled way. And it's really important you refine your skills, because you can permanently lengthen tissue inadvertently if you don't have skills that really connect with the tissue you're dealing with. And that's going to be affected by the dog's age, what tissue you're touching, what you're trying to get out of that release. So, but these are very useful tools, and I use them aquatically and I use them on land-based. I hope that helps. Right, Dave Taylor, you're pushing me, Dave. Barb, it would be really useful. Right, so the question is, it would be really useful to have a directory of all the different holds and their purpose. That is why you come on our courses and we teach them. And it's much better to get a few and refine them rather than having a huge directory, but maybe not understanding exactly why you would use it or what. So we're not just applying these randomly, we're clinically reasoning, therapeutically, and working out which one would be the most appropriate for that dog, and we're being responsive with the dog's feedback on that moment. And so you'll see me when I'm working in the pool or working with the dog, I'm literally like going through the gears. I'll be going from one hold to the other until I find that perfect fit for that dog in that moment. And very often you'll see it, and we've got a great bit of footage in the level 5 course where you can literally see the dog. It's all in slow-mo, stop the moment that this particular air gap hold comes on, which is so much more powerful for the dog in that moment than the weather hand hold, the spider hold, all the different holds that we've devised and sort of shared with people over a long, long time. But it's something I'll think about, Dave. So who knows? In my spare moments. Okay, Jessica. That's a good question. Do you offer CPD practical days on myofascial release, hydromassage, rather than offering them online CPD? Absolutely. We offer masterclasses and clinical placements that are completely individually led. So what that means is that you can book up a clinical placement masterclass with us. We have an interview with you and find out what your skills are, where you're at on your journey, what do you want, what are you needing? And then we refine and fine tune a masterclass to meet you on a one-to-one or 2 or 3 people in a group with 2 of us, and we teach you these techniques face-to-face, and then you've got the online CPD and the online courses to back it up as well. Absolutely, definitely. So thanks for that, Jessica. And the next one. In the poll, you list Canine Pilates and Canine Tai Chi. Can you say more? Oh, sorry, Bernadette, got to do my timeline. So in the poll, you list Canine Pilates and Canine Tai Chi. Can you say more about these ideas? Not ideas, these are techniques. So Canine Pilates, whether we apply canine type Pilates exercises, where we, thank you, Jessica, where we employ specific body posturing, therapeutic touch and therapeutic handling to engage the dog to go through a sequence of controlled guided movements and using motivators occasionally, maybe the owner, maybe a treat, maybe a toy, but very often not, because we really want that dog to consciously mediate and work with us in that moment, are hugely proprioceptively enriched treatment techniques. And we've had some fantastic research come out about Tai Chi, the sequencing and movement sequencing in the human world, saying how amazing they are for engaging the core, getting a strong core. And we know with the dog, it's absolutely vital to have a strong core, to have the epaxial muscles engaged, particularly caudally, because it won't matter how much you work on the pelvic limbs, how much you work on the hind limbs. If you do not have a strong core, even the smallest amount of power will not transmit from the power muscles, your gluteals and hamstrings, up through the body and take the dog forward in a straight line, which is designed to move forward in the sagittal plane. So these canine type Tai Chi exercises we're doing, we're getting profound results with our neurologically impaired dogs, with our performance enhancement dogs. We have to be very, very careful with these sequences that we link in with therapeutic handling into natural balance work. These are not trained sequences. And in Dogs in Natural Balance Motion, we explain why we are not training dogs. We're not using training techniques. That's for trainers who want to train a specific task. That's for owners who want to train a sit to a treat. Therapists are working in natural balance and utilizing a whole toolbox of treatment techniques to enhance their day-to-day natural balance movement and postures. I hope that helps with that one, Bernadette. Bernadette. Well, yes, it's part of the Natural Balance Motion course, which I am working really hard to get released for May. So yes, it is part of that. Thank you, Bernadette. So just seeing if there's any more questions. I think that's the questions for the moment. I'm just going to have a look at the polls. So really interesting. Things have changed since you've all come on board. So that's great. So initiating contact with the dog, using therapeutic canine touch for, fantastic. Calming the dog, brilliant. Sensory therapeutic techniques. These are techniques where you can target specific areas. They're the dermatones supplied by nerves that also supply muscle, and you can influence the anti-gravity muscles. You can influence the extensors, because it's the extensor pattern we are very concerned with, because they're the ones that keep us up against gravity, and they're the ones that support the dog up against gravity and support the dog through the ground reaction forces, particularly the vertical ground reaction forces. You should not be encouraging flexor patterns, because that is what a dog does when it's lame. It's the extensor pattern for engagement and power of movement. Clinical massage, brilliant. Myofascial release work. Key points of control. I really want to sell key points of control. They give you the complete controls to help a dog move with you in a guided, focused, bonded way. There's so many key points of control on the dog that you can utilize in all your therapy approaches that will give you that opportunity for the dog to actively engage with you, to literally a sequence that you ask by a body posture that you engage with them. So they're very exciting things to use. Palpation of swelling and edema. Well, we use therapeutic touch as well as assessment tools, and we're palpating for heat. We're palpating for cold spots, hot spots, swelling, effusions. And I'm thrilled that no one's really said anything about palpating for pain, because seriously, if I prod you hard enough, I can make it hurt. So palpating for pain is a very subtle, graded therapeutic touch, because we don't want to take the dog into a painful state and then ask it to move, but we want to detect the painful state. Paw assessment. We need to talk about canine foot balance, canine paw balance. It's huge in the dog. It's huge in the horse, it's huge in the person, in the human, but no one's really exploring canine foot balance. And it's a fantastic thing, particularly for your performance animals, your agility animals, your working animals, particularly for the elderly dogs that are really going off their feet because their paws are so stiff and painful to use. So a fantastic area. Maybe you'd like a crowdcast on foot balance in the dog, paw balance. Let me know. Alignment techniques are a fantastic technique to help the dog move in natural balance motion. You can use them statically on land, dynamically on land and in water. Body and lead work. So yay, we've got loads of responses there. So whoa, coming down to the second poll, by far you want to know about therapeutic movement shaping for balance motion. So I gave you two choices. I'll do one or the other. Therapeutic sternal hold techniques for balanced stand and for balanced engagement, because now I've explained that sternal hold is all about balanced engagement, dynamic work. Movement shaping is your body posturing next to the dog and how you can influence the dog's movement using your body posturing. Somebody wants a whole course on paw work. I've got a busy year, I think, Bernadette. Yay. Thank you, Claire. So keep voting on that one. I'm just going to wrap up and go on to the last slide, but let me know in the poll whether you would like the sternal hold techniques, and I can show you a whole range of different sternal holds that you can use to control that dog in a calm, focused and connected way, or whether you want to have a look at the movement shaping techniques. Both are part of therapeutic handling. So any more questions? Please post them and ask the questions. That would be fantastic. Really rely on your feedback. if you can tell me if you felt this has been useful. We've run over the hour just. Now, don't forget, you can go to the resources page on www.caninehscourses.com. Click on the resources page and you can claim your certificate. Part of that is you are going to do some reflection, and that completes your CPD requirements, because it's not about attending a course. It's not about attending a conference. I've been present at a conference, and when something comes up about a horse, or I'm hungry, or I'm a bit tired, I might be there in person, but I'm not actually present for a few minutes. So it's really important that you have diverse CPD experiences. And then what you do with your CPD experience is you need to reflect, how is this going to affect my practice? So I'm not asking for feedback to me. I just want you to complete your CPD requirement. And what that takes is thinking about what we've discussed, thinking about the questions you've heard. What has that helped you with in your practice? Is it going to take you forward? Can you incorporate it somewhere? How is it going to affect you working with dogs? And that's what CPD is all about. Clinical reflection on the different topics that you come across, and then incorporating that into a statement. And then that in itself completes that CPD, and then you get your PDF, your certificate that you can download. Sorry, it's not a PDF. I got a few questions last time. If your trade association that you are entering these certificates for demands a PDF, you can do that within your own computer. It downloads as a document and you just save it as a PDF for them. Okay, so don't forget to get your CPD certificate if that's what you need. Thank you so much for the feedback. I'm reading the answers. Thank you so much. Please let me know your feedback if you felt this has been useful. I'm going to sign off for now, and it's been great. I've really enjoyed it. I'm still IT nervous, and I really appreciate your patience with my stutterings and trying to find the slides. It's been fantastic. And next month, we're going to do a Canine TV. It's going to be a mini 3-minute instructional Canine TV, free for you guys. You can go on it and you can watch it as many times as you want. I'll check the poll. I'll fashion it to what you've decided you want to have. And then we're going to come back in May, and it's going to be middle of May, and I'm going to look at muscle injuries in the dog. So exploring canine muscle injuries, which I think you'll find really interesting. They're subtle. They're very prevalent. You really need to know where to hunt for them, how to find them. And when you can use your therapeutic handling skills to be able to find these subtle injuries and then also to address them. Thank you, Ash Ponting. Great, I did well with no IT backup. All right, see you next time, and keep polling on which Canine TV you would like me to design for you, and we'll go from there. Cheerio.